Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center. Though we're not going to talk about neck injuries today, we're going to talk actually about golf injuries. I've loved golf ever since I was a little kid. When I was 8 years old, my grandfather, may he rest in peace, he got me a set of Chi Rodriguez clubs. So that was my first golf set, was Chi Rodriguez. Then years later, the pilot for Chi Rodriguez, I got to play with him. You know, that was the pilot for his airplane. And he said to me that a physical therapist had given Chi Rodriguez my book called Prolo Your Pain Away. And that's what then Chi had given the pilot the book Prolo Your Pain Away. And that's how I met the pilot. And then we played golf together. So that's like, God is so good, you know. Here I got to meet somebody who knew Chi Rodriguez really, really well, and he was just a great guy. This is actually one of my favorite pictures that Izzy took. This is at where I play a lot of my golf, Cypress Lake golf course. Then, that's the practice facility. Obviously, I actually do love yellow. I didn't know if you guys knew that, but I often dress in yellow. That's my bag, my clubs. And currently, Dr. Hauser is a 6.4 handicap, 6.4. Lowest I've been is 5. I just don't practice as much as I should, so I'm a 6 handicap without really practicing. So love golf. Was the #1 golfer for my high school. Then got away from golf to be a doctor and start a practice, and then just need to do something beside medicine. So right now I'm playing more golf, making some friends, so it's been awesome. But anybody who's played golf, man, it is a strange movement. It just really is. And the most common injuries that when they do scientific studies, most studies show that low back injuries are the most significant with golf. But believe it or not, in some of the studies on women, the most common injury is with the elbow. So that's kind of interesting. So in teaching professionals, these are the injuries that the people who play a lot of golf get, and we see low back, shoulder, elbow, wrist. Professional golfers get more injuries because they hit more balls. The main thing they found to reduce golf injuries is actually just warming up. And they found 2/3 of people don't do any warm-up. And it's true. So if I was going to say if there's any part of my body that hurts after golf, it's my back. When I warm up, I just have so much less tension in my back with playing golf. So see how only 60% of players adequately warm up before playing. So #1 thing to prevent golf injuries is definitely warm up. Golf injuries among amateurs, 60% or so have some type of injury. Men, it's the lower back. Women, it's the elbow. Golf handicap not related to the types of injuries. In our office, when we see somebody who's had a sports-related injury, whether it's golf or pickleball, it almost always is related to some type of instability. If somebody's low back hurts, we normally do a motion scan of the back to show the instability. If it's the elbow, we do various tests, including ultrasound, dynamic ultrasound exams to show the elbow instability. Oh, here. This is Nick, one of my clients. That's Russ Hurst, Pastor Russ Hurst of First Assembly. This is one of the days where we were playing at Cypress Lake. Just had an amazing day together. They're both just really, really good golfers. And then here's me. You'll get to see my swing. Oh, look at that! Look at that! This shot's going to be amazing. Yeah. Oh, what a swing. Oh, look at that. Just like Payne Stewart. Look at that. Oh, what a shot. Look at that. Oh, it's just beautiful. We have to assume it's like right down the fairway. So I hit my drives about 235. You know, I have a very stiff thorax, so I could probably get up to about 260. You know, if I really, really worked at it, got some more flexibility in my thorax, hit the ball a little bit cleaner, but I'm pretty good at 230, 235. So the tees I play are normally 6,500 to 6,700 yards. You know, obviously golf, there's a torque, there's a twist, there's a tweak. You know, I showed you Pastor Russ. Pastor Russ definitely after golf, definitely has back stiffness. So anybody who has back stiffness, a lot of back stiffness after golf, it's likely that they have instability, instability in the lower back. Obviously, if it lingers, like if, you have it for an hour, whip-de-doo, but, really if it's there the next day, instability is a progressive disorder. It really is something that you should have treated. And again, the way you diagnose it is like anything that's loose, you have to move it. If you feel that the hinge on a cabinet door is loose, you can't just look at the door to know that it's loose. You actually have to move the hinge. Then you'll feel the clunking, the extra motion of it. So that's how ligamentous joint instability is too. So if it's the lower back, I can have somebody twist, I can have somebody bend, I can have somebody squat, and we can see in real time, are the adjacent bones moving together or is one moving excessively? And that's what ligamentous lumbar instability is. I have this slide up here just to show you that in the lower back, there's actually 5 joints. There's the lumbar joints, how the lumbar vertebrae come together. There's the lumbosacral junction where the lumbar vertebrae via ligaments attaches to the sacrum. There's the sacroiliac joints. Then the front of the pelvis is the pubic symphysis. So this big bone's called the innominate bone. There's a joint here. There's ligament attachments here, but then the front. So you could have chronic low back pain because this bone's moving too much, and it can be from a pubic symphysis injury. And then the socket portion of the hip joint is in this bone. So this bone absolutely affects the hip. So somebody could say that I can't turn good on the golf swing, and they got groin pain, and it literally is from ligamentous injury in one of these 5 joints. I love this slide because people don't think about all the joints that affect the lower back, but there's 5 joints actually. So this is the ligamentous support of the lower back and the hips, the ligament support of the 5 areas that we said. You have the lumbar ligaments, you have the lumbosacral ligaments, this is the iliolumbar ligament, you have the sacroiliac joints and the sacroiliac ligaments, you have the sacrotuberous ligament. That is a direct connection of the lower back to the buttock region or the pelvis. Then you obviously have the hip ligaments. So almost all chronic symptoms, I'm not talking about acute symptoms, but chronic symptoms are ligamentous because massage or exercise or adjusting doesn't stimulate ligament repair. Ligament repair, you have to stimulate it directly, and the way you stimulate directly is prolotherapy. Prolotherapy is an injection technique where the injections go where the ligament attaches to the bone to induce the cells to proliferate. So prolotherapy is short for proliferative therapy. It causes the fibroblasts, which make up the ligaments, to proliferate, and then all those massive amount of cells lay down a lot of collagen tissue that causes the ligaments to tighten and strengthen and thicken, and that's what resolves the instability. And especially if you have clicking, popping, grinding in any of those joints, you know that it's loose, so the treatment of that is prolotherapy. This just shows you all the different ligaments, and then what supports the discs are the ligaments. So when you have disc degeneration as evidenced by MRIs, the cause of the disc degeneration is normally that the vertebrae that the discs are between are moving too much, and that's what causes the destruction of disc cells that we know as disc degeneration. So the cause of disc degeneration is lumbar instability. So the treatment of it needs to be directed at correcting the excessive motion of the bones, and that's by prolotherapy. And this just kind of shows it that you have rotational forces on the disc, and that causes the disc to get injured. So you could say, well, I need to not have rotational forces. Yeah, but there's other people who play plenty of golf or plenty of soccer, plenty of baseball, and they don't have any problems. So the treatment isn't to not do the sport. Why don't you just get it corrected? Because again, any sort of injury or illness in the human body, it's almost always progressive. So you always want to get at the root cause of the problem, and the root cause of the problem is the instability. And these instabilities cause lots of other problems beside pain. Because if you just think of pelvic instability, it can cause, buttock pain, psoas syndrome or clicking hip syndrome or snapping hip syndrome, iliotibial band syndrome, which can give you knee pain. It can cause vaginal pain, interstitial cystitis, pelvic floor syndrome, prostatitis, all kinds of things. And then this just shows that in a cadaver, it's a mesh of ligaments. So basically, when you do prolotherapy, you're treating this whole mesh. It's a mesh of ligaments. It isn't like some little strand here, little strand there. It's like this whole mesh. It would be like in Southwest Florida in the mornings when I drive here, you'll see the fishermen with the nets, and they're going out to catch bait fish. And I'm sure those nets, man, they do not have any cuts in them, because any sort of cut in any of them, it weakens the whole thing. And the cut where it's torn, it's just going to cause the whole thing to go bad. Well, that's exactly how this mesh is. You start having a weakness here, the next area gets weak, the next area gets weak. This just shows that per vertebrae, look at this, there's 11 different muscles that attach to every vertebrae. So what's going to happen if you have instability or extra motion? What's the body going to call upon to stabilize or limit that bony movement? It's going to be one of those 11 muscles. Well, what if one of those muscles goes all the way to the neck or goes to the upper thoracic? Well, you could have upper thoracic pain and it's from low back instability or pelvic instability. Because some of these muscles, they're humongous. Latissimus dorsi muscle, that goes all the way to your shoulder. And then it has an attachment in the lumbar vertebrae. I mean, so that's where then somebody goes to a physical therapist, right? And the physical therapist is, I'm going to relax the muscle, relax the muscle, relax the muscle. Then the person's like, I'm getting worse. Yeah, you're getting worse because the physical therapy is being successful. It's relaxing your muscle, but the muscle is stabilizing the movement of the bones. So that's always intrigued me, because it just means the physical therapist is doing a good job. Like, they actually got the thing to relax, but the tightness was necessary for right now to stabilize you. And this is what prolotherapy is. Prolotherapy just goes to various ligaments and starts the stimulatory process. It signals the body to start regeneration. And once the ligaments regenerated, the lumbar vertebrae don't move in destructive ways. They just move in normal ways then. The low back pain goes away, and probably your handicap's going to go down. Okay, so, like I said, remember I said low back injuries, but in gals, a lot of times it's elbow injuries. So with the golf swing, like in Southwest Florida, what we have here is some of the courses have cart paths, but the cart paths in Southwest Florida, they're playable. Like, in other words, you're actually supposed to, because they're kind of sandy, they're maybe a little bit rocky. So some of us, obviously we don't want to scrape up our clubs, so we might move the ball. But in most tournaments and everything, you've got to play it. Well, as well as I do, if you hit a rock or you hit a stub or you hit a tree stub or whatever, and then all of a sudden there's the boom, man, all that force goes to your elbow. So that's one of the reasons why I think that elbow injuries, now gals are looser jointed than guys. You don't realize, like, when you're a good player, man, you're hitting down on the ball, you're hitting down. And then what's happening is, like the club, like you're going like this. So that's similar to like tennis, right? Like you're going like that. So the golf swing, you don't think about it, but it's actually a similar motion. That's why you end up getting elbow injuries. Now, most elbow injuries are, again, from ligamentous injury. Now, the radius, most of the injuries that I find, they're on the radial-collateral ligament or the annular ligament. So the radius bone is what turns you over. This is the radius bone. So when you have pain here, that's normally the annular or radial-collateral ligament, and on this side, it's the ulnar collateral ligament. And then common symptoms are popping, elbow pain, muscle spasm. You can get, when you have a ligament injury here, it refers down the hand, and you can get symptoms similar to carpal tunnel syndrome. So if you have numbness or a nummy feeling, and numminess versus numbness, numbness is true loss of sensation. Numminess is you feel like it's numb, like you have this sensation of numbness, but when you go like this, you can feel everything. I term that numminess. Numminess is almost always a ligament problem. So the ligaments on the lateral side of the elbow, they refer pain down the thumb and the two fingers, similar to carpal tunnel. The ulnar collateral ligament gives you numminess in this side of the hand, the ulnar side of the hand, and these two fingers. So when you tighten the ligament, you inject the ligaments get strong and tight, the numminess goes away. And of course, when you have ligament injury, you lose muscular power. So the maximum muscular power a person is going to have, whether it's a golf swing or running or just doing your daily activities, necessitates a stable joint. So imagine somebody's moving or playing golf and the elbow's unstable, you're not going to be able to generate the power. So if you're playing a sport, whether it's golf, pickleball, whatever, and you just notice, man, there's not as much zip or the ball's not going as far, it could be like the lower back has instability or the elbow has instability, and that's why you can't generate the power. And again, eventually, because the force then goes on the muscles that are trying, or the tendons that are trying to stabilize the joint, the tendons eventually tear. So if you've been diagnosed or somebody said you have a tendon tear, it's likely that you have an underlying ligament injury, or if you've had the tendon repaired or you've had PRP injected into the tendon tear and it didn't really help, it's probably that the tendon tear, the tendon injury, or the tendinosis, degenerated tendon, is secondary to underlying joint instability. So you need to get the joint stabilized with prolotherapy. And normally, if somebody has an associated tendon tear, we will inject PRP in there, but it's not just PRP into the tendon, it's PRP and prolotherapy to the underlying joint, and that's what resolves it. So elbow instability can cause tennis elbow, tendon tears, degenerated tendon, tendinitis. On the ulnar collateral ligament side, you can get ulnar nerve irritation. You can have, in kids, you can get osteochondrous dissecans where the cartilage breaks off. You can get a cartilage defect. It's normally an underlying instability. We do stress maneuvers, then we ultrasound. This is just me doing a stress maneuver. And then, we look at, is the elbow bones, are they moving apart? So that's how we would diagnose the instability. And then, we do prolotherapy. We don't have to do it under x-ray. This just shows where the needle, you can see the needle right there. So, the needle hits bone, and I guess we're done.